Patient awareness under general anesthesia is rare. In fact, 99.9% of all surgeries are accomplished with the patient unaware and pain-free. Awareness occurs when surgical patients can recall their surroundings or an event related to their surgery while they're under general anesthesia.
Although it seldom occurs, even one case of patient awareness concerns us as anesthesiologists because we know it can be very distressing to our patients.
Anesthesiologists are highly trained medical doctors, physicians who do everything possible before, during, and after surgery to make sure their patients receive the safest and best care. During the infrequent occasions when patients experience awareness during general anesthesia, they usually do not feel any pain. Some patients may experience a feeling of pressure. Some patients may hear conversations or other sounds during surgery. Others may feel the breathing tube as it is removed from their throat at the very end of surgery.
Our study of patient awareness over the last 40 years shows that many patients have some fleeting perception of their surroundings just before anesthesia takes full effect or as they are awakening from anesthesia. Other patients dream during surgery and think that they are aware. These occurrences are normal and are not considered true patient awareness.
Each person's body reacts differently to anesthesia.
Patients have many memories surrounding their anesthetic. However, if the anesthesiologist and the patient agree upon a regional block technique or a conscious sedation as the method of providing anesthesia care, then recollection during the procedure will occur.
This is not awareness. It is the normal recollection of a patient who is conscious.
Patients having high-risk surgery, such as emergency cesarean section, surgery for acute trauma, open heart surgery, or even instability during a normal operation, may require less levels of anesthetic to be given, and therefore those patients could be at increased risk for awareness during the procedure.
When the patient is fragile, use of a deep anesthetic would not be in the patient's best interest.
In these cases, the anesthesiologist will weigh the potential for awareness against the need to keep the patient safe. To protect the patient, lighter anesthesia may be required, and awareness may not be completely avoidable.
Patients can be comforted by the results of a recent study of more than 87,000 patients at 8 different hospitals that shows a very low rate of patient awareness, approximately 1 in 40,000 surgeries for those who are not high risk.
I would tell every patient that my primary responsibility is to get them through the operation safely and without awareness. There are many things that we can do to minimize the risk of awareness under anesthesia. Each patient is unique. Each patient has different anesthetic requirements and concerns.
Research has consistently shown, however, that patients are safer when an anesthesiologist is involved in their care.
If you look at all the cases of true awareness, which is a very small number of surgical patients, and then you take away the ones that can be expected, you're left with an extremely small number. It's not unusual for anesthesiologists to practice for 30 years and never have a patient who was aware. Before surgery, patients should talk with their anesthesiologist to discuss anesthesia options. This is an ideal time to express any concerns regarding awareness.
Patients should share any problems they may have had with previous anesthetics. It is also important for patients to discuss any prescription or over-the-counter medications they are taking and any medical conditions. The American Society of Anesthesiologists has been at the forefront of research to evaluate various techniques and technologies to decrease the likelihood of awareness.
I chaired the ASA's Task Force on Intraoperative Awareness, which spent over 2 years analyzing the research in this area. We then developed guidelines to help anesthesiologists and hospitals minimize the risks of awareness under general anesthesia.
During surgery, anesthesiologists monitor their patient's condition and vital signs with up to 12 different monitors using the most sophisticated technology available.
Today we have state-of-the-art technology, new anesthesia drugs, and the expertise, experience, training, and judgment of your anesthesiologist. This means that patients from the tiniest premature baby to the most ill of our elderly can safely undergo needed surgery. The result is 99,000 quiet victories each day for our patients.
If you have questions before surgery, we encourage you to visit the website of the American Society of Anesthesiologists for more information on the various types of anesthetics, as well as patient awareness. The website address is www.asahq.org. Working together, you and your anesthesiologist can make surgery as safe and as comfortable as possible, so that you can enjoy the most important things in life.